Welcome everyone to the 2021 CIPD Applied Research Conference. We're delighted that you can join us. My name's Jonny Gifford. I work in the research arm of the CIPD and I direct the Applied Research Conference. This showcase video on workplace wellbeing interventions is going to give you some insight into work in progress that is being undertaken as part of the ESRC funded Propel Hub, for which CIPD is the impact partner. I'm joined today by several colleagues involved in this project. Kevin Daniels, who is Professor of Organisational Behaviour at UEA. Kevin leads the overall project that we're going to be talking about today. Chris van Stolk, who is the Executive Vice President for RAND Europe. Chris leads the Britain's Healthiest Workplace Service, and the analysis work that he'll be talking about comes from that. Sara Connolly, who is the Professor of Personnel Economics at UEA and a co-investigator on the Propel Hub. Dave Watson, who's a lecturer in Organisational Behaviour at UEA, and Olga Tregaskis, who is Professor of International HRM at the UEA. All of the researchers today are involved in the practices and combinations of practices for wellbeing at work project. And we're going to be talking about what the focus is of this project, why we need it, and what the work in progress is telling us. Kevin, first of all, obviously there's a lot of work, a lot of research already on workplace well-being. What does this research package tell us, or what will it tell us that adds to the body of knowledge?
I think there's a number of key issues that we don't know. So we know actually quite a lot about what works. There's plenty of controlled trials of different interventions. In practice, though, what organisations do is they don't do single things in isolation. They tend to do lots of different wellbeing initiatives simultaneously, or at least some do. So we don't know anything much at present about how combinations of practices actually lead to improvements, that's positive changes over time in wellbeing. We know even less about how to implement those combinations of practices. And then we also that there's gaps around sort of links to productivity and how the practices then have some kind of performance outcome, if you like, as well. So I think that those is the key problems, really. And there's another huge problem, which is the elephant in the room, which most of us don't address in our research, is we don't know how cost effective these things are. So which particular initiatives are going to improve, give you a given level of improvement in well-being for the best price. And that's one of the other things that we're looking at as well, and part of these several interlinked work packages that we're working on.
So it seems that from the body of research that's already out there, we've got some quite clear ideas about individual interventions, but what we're looking at here is what happens when that hits the messy reality of organisational life. Absolutely. And how different interventions might combine. And I suppose that's why there's particular value in having a work package like this, of bringing together different pieces of research which tell us, which kind of fit together as different pieces of the picture, and together tell us, give us more insights about how things really work.
Well, absolutely. And I think the point you make there about it, you highlighted about the combinations, because it's entirely possible. Of course, different wellbeing initiatives could undermine each other, or you only need A, you don't need A and B. Although it seems we're finding you probably need A, B, and C and D. But, we didn't know that when we started off.
OK, thank you, Kevin. I'm going to bring in Chris now. So, Chris, tell us a bit about Britain's Healthiest Workplace and how you're using it within this research.
Yeah, thank you, Jonny. So Britain's Healthiest Workplace is a long-standing initiative. It's basically a large-scale survey of large employers in the UK. It surveys a sample of employees within a specific employer and also a representative of that employer separately, typically an HR representative or a finance director, somebody of that ilk. So what we're trying to understand is what is going on in terms of health and well-being within an organization. So that's the survey element, but in this project we decided to do something slightly different and try to actually look at the survey data next to administrative data. So we took a case study approach in some large employers, very well-known employers in the UK, and tried to understand what we saw in the survey, whether that related to what we could see in the administrative data. Of course, the gold standard within all of this is where we could merge individual personnel records directly to the survey data. Of course, that's difficult to do, and we were only able to do that in one specific instance. But in that instance, we could draw out some really interesting conclusions on the link between health and well-being and productivity. Even though we accept that this link exists, it's still really important to draw this out. So for instance, what we could see is that better employee health and well-being is associated with better management assessments, higher bonuses, for instance, and also some very specific examples of, for instance, where better health and well-being was linked to, for instance, a net promoter score, which is something that is given to, for instance, people who work in sales and so on. So these are kind of some really interesting inferences, and starts making that business case in terms of actually, building that link between health and well-being and productivity, and why employers should do something about this. But then there are also some other elephants in the room that we know about, such as mental health and its link to productivity. So in another employer, and this time a large financial services company, we looked specifically at mental health, ill health, and how that's contributing to their productivity loss. It's by far the biggest contributor to their productivity loss, in which groups within that organization it sits, and also whether those groups were participating in the health and well-being interventions that Kevin already mentioned. And not surprisingly, what we saw is relatively low participation among those people who actually suffered the most with poor mental health. So there seems to be a disconnect between participation and also of certain groups and these type of outcomes, which of course impacts again on productivity. And then finally, but not least, a case study that we're doing on a large retailer. What we're doing there is looking at a resilience intervention that they put in place during the COVID-19 lockdown to support the well-being but also resilience of their employees, to see whether that had an additional impact in terms of the overall well-being of their employees. That's a very specific study looking at a very specific issue, but nonetheless thinking about mental health and resilience as being some of those key factors in terms of driving productivity at this point in time. We felt it was probably worthwhile focusing on that.
I'm going to move on now to Sara. So Sara, you're taking a more granular look at what works in individual wellbeing interventions. Can you tell us about this research?
Yes, thank you. We know that organisations actually provide a plethora of support and workplace interventions, whether it's fitness programs, whether it's volunteer programs or health and well-being programs. And what we're looking at in this cost effectiveness piece of work is what impact each of these things have individually on people's well-being. And also, what does it do to their productivity? Now, I'm suggesting here that we're looking at a causal mechanism, because we are seeing what people's well-being was, what their productivity was beforehand, and then what it was afterwards. So we are actually looking at the change that we see over time. And one of the very interesting things is that we're finding that many of these interventions are having a greater effect on those people who had low levels of well-being initially. So there's a greater improvement in well-being for those who were least happy, least satisfied with their lives. And in terms of productivity, What we're also observing are improvements in terms of fewer days of absenteeism and less presenteeism for those people who have participated and engaged in the interventions.
Dave, you're going to tell us a bit about the evidence and how this relates to the current context. Is that right? Of COVID?
Yeah, that's right. Thanks, Jonny. So we've been following 8 companies over the last year or so, and we've been carrying out qualitative interviews with these companies. I think we've done it in excess of something like 200 interviews or something like that now. So we've got a really detailed picture of what's going on within organisations. And obviously we've been doing it over a very unique period of time with the COVID-19 pandemic kind of really becoming a reality in March of last year now. And I think that's made things really interesting for us, actually. And if anything, it's made the research more relevant. I think there is a sense in terms of the way society is thinking about well-being, and people in their everyday lives are really kind of focusing on this issue of well-being. And that has had effects on how organisations are starting to prioritise that as well. And it really raises the question for organisations of how they prioritise well-being versus productivity, because the pandemic has been not just an economic shock, but a health shock. So that's really raised the question for organisations. It's also forced people to work very differently. So people are working from home way more than they were before. But this is not necessarily a new thing, but it's a trend that's been accelerated by the pandemic. And people are working much more with digital mediums than they would have been previously. You know, we're doing this over computers, we're not doing it face to face. So some of those trends are things that were probably going to happen anyway, but have really been accelerated by COVID-19. So understanding the impact of that, the way in which work is changing, is really relevant to how we think about how we manage well-being and productivity. But the thing that is really done as well for us when we've been collecting this data, the thing that we've really noticed is how the pandemic has sort of put a microscope on where an organisation's priorities really lie, whether it's around well-being or productivity. How authentically are they pursuing those goals of well-being, and how do they demonstrate that to their employees and ensure that they're looking after them well? And I think there are some long-term learning lessons from it, definitely.
Thanks, Dave. And finally, Olga, what are the take-homes for practitioners, and how can they go about implementing them in practice?
Yes, I mean, one of the real priorities for us with doing this programme of research, and in fact the work that we've been doing for the past 5 years in the wellbeing space, has been to use the science to help change practice and to support practitioners. And I would urge people to actually look at both the Propel website and the What Works Wellbeing websites, because here what we do is we take this science, this evidence base, and we translate it in ways that is meant to be accessible and usable to help with implementation. And there's 2 strands, I think, of the work that can be mobilised really in practice. One is the strand of work that brings the evidence base together, that helps you build the business case for resources and helps you sell the case to the different stakeholders that will be involved in wellbeing and productivity initiatives in organisations. And here we're using the secondary data sets, systematic review evidence, and that allows us to look across hundreds of organisations and thousands of employees. And it also allows us then to draw out that evidence and to rank it in terms of the strength of which we believe that evidence actually is predictive and is strong evidence that you can then use to support the practices and the resource investment that you're putting into activities in organisations. So that's one body. The second body, and the kind of more tricky area of evidence, is, of course, is that implementation science and that implementation process. So as we've said throughout, all of the presenters have said, it's not a case of having those practices. Those practices on their own do not work necessarily as we might expect them to. It's about that implementation, which is an art, and the science of where the practitioner really comes to the fore in making it a reality, making things work the way you would hope. And here what we've done is use a lot of the qualitative evidence and the case study evidence that Dave has just talked about and Chris has also talked about, bringing that together to try and draw out what are the principles across all of these studies that help us show how organisations are achieving the implementation. And again, there's a lot of implementation tools, and there's principles that we've drawn out. There's 5 C's in particular that you might find useful, where we talk about communication, commitment, coherence, consistency, and creating those new practices. And it's how organisations bring those 5 principles together so that you are creating and evolving and adapting your practices, David has just said, so that they're not staying the same, but they are changing, they're self-correcting, they're self-challenging, and they're learning as you're moving forward. And that seems to be the elements through which these organisations are actually creating the well-being that meshes with productivity, and it's not a standalone and it's not separate. So I'd say there's a lot of really strong evidence there, which hopefully people can draw upon now.
Thanks, Olga, and thanks everyone. So I think it's clear from existing research that surface level interventions for well-being are not enough. You can't have bowls of fruit and expect to have a positive impact if you're piling on the pressure at the same time. But what we're adding to with this is a more contextualized view of how that works in practice, and in particular the implementation of that. I think it's a fascinating body of research that we're producing here. And thank you everyone for listening, and thanks for your contributions. Bye now.